Hi, it's David Ayres from Core Physiotherapy and Pilates Studio. Today we're going to talk about tennis elbow, how you can identify it, and how we as physios can help you manage the condition. Tennis elbow is a condition that affects the outside of the elbow. It's common in sports such as tennis, obviously, but also in other sports such as cricket. But in the workplace, it's also common in any activities involving repetitive gripping and lifting, mouse and keyboard activities. So a lot of office workers end up with this sort of condition. If we're talking about where the symptoms are typically most prominent on the outside of the elbow, so around this point here, but also the pain can extend down into the forearm here. So those symptoms might be there constantly, like an aching pain that's there all the time, or they might be more intermittent, so more when you do things like gripping, lifting, even things like trying to open a can or turning a doorknob can certainly affect those symptoms as well. So the reason why we tend to get tennis elbow is particularly just that repetitive overuse of the muscles through our forearm here. So those forearm muscles attach into a bone at the elbow here. So it's a common attachment for all of these muscles here that actually extend the wrist and fingers. So that's what we're sort of looking at when we're dealing with someone with tennis elbow. In terms of looking at the assessment, it really is diagnostic by the area of pain, the history of a frequency of recurring activities, particularly those lifting and gripping. That's where we sort of come to a diagnosis that we've identified that we've got tennis elbow, and then we want to look at how we manage it. Okay, so once you've seen a physio and they've diagnosed you with having tennis elbow, the next stage is to look at the management plan. So we'll normally start with a 3 sort of stage management plan for tennis elbow. The first stage of that is to obviously again work on the initial issues, which are going to be pain and inflammation. So we do that by focusing on some relative rest of the tissue. So obviously avoiding things like heavy gripping and repetitive lifting and stuff like that. We use ice over particularly the elbow area. And we can also use some things like taping or bracing to try and reduce some of the pressures and forces that are coming through the elbow. So one of the braces that we'll use is this little tennis elbow strap, which just basically goes around the forearm and can help to relieve some of the pressure on the attachment of those forearm extensor muscles into the elbow there. So after we've reduced some of the pain and inflammation there, we then start to look at restoring some of the length through the forearm muscles, trying to reduce some of the tightness there that's causing some of that pressure. So we do that with particularly some hands-on treatment, so things like massage, dry needling, but we also can do some stretching exercises. So one of the simple stretching exercises that we often give people with tennis elbow is just a simple stretch that we're going to show on Olivia here to stretch out through here, is just a forearm stretch. So if we get you just to close your hand into a fist there, keeping your elbow straight, and then just using your other hand to just gently flex the wrist, okay? So that should give us a nice gentle stretch through somewhere along those forearm muscles, somewhere down towards the wrist even, and we're gonna hold that stretch again for about 15 to 20 seconds and repeat it sort of 2 to 3 times, and really it's something that you could do 4 to 6 times a day quite easily, okay? So hopefully once we've settled down some of the tightness in the muscle, we then want to go about restoring the function in the muscle and the tendon through here. So we do that through a graded resistance strengthening program. So there's a lot of different exercises that we can actually use, but what we're actually going to start by demonstrating for you today is just a simple little exercise with a dumbbell. So if we can get you just to rest your forearm onto that towel there, Olivia, and get you to hold on to the dumbbell. So the idea here is that we're basically just starting to put some load back through the muscles, getting them used to that so that we can hopefully get back to the activities that we were doing before the injury happened. And then what we're going to do is just get you to drop your wrist down and then lift back up. Okay, so when we're lifting back up, we're working through those little elbow muscles, and then back down and then back up again. Okay, so the key with tennis elbow is really getting an early assessment to minimise the chances that that tennis elbow is going to give you some long-term issues. If you have tennis elbow, then there's some great information on our website. But yeah, certainly if you think you have, the best thing to do is start coming, book a time with a physio and get on the way to managing appropriately.